Thank you so much for staying and for listening and for participating. Thank you for your energy, for singing. That was unexpected. I've been here more times than I would like. I've been in this rotunda speaking to groups of healthcare activists year after year after year fighting for the Medicaid expansion. Trying to save lives because according to a Harvard University study, there are thousands of people dying in every state, throughout the country, just in those states that haven't expanded Medicaid. So now, instead of the progress we've been trying to make, trying to go forward, now we're looking at going backwards. Now we're facing a massive step backwards, which is unfortunate because Obamacare, the Affordable Care Act, ACA, it works when it's allowed to. Overall enrollment nationwide is 30 million people have gained coverage. Our nationwide uninsured rate is down to a record low 8.6%. There are people, regardless of where you get your health insurance, I guarantee you every single one of you has benefited. Every single American who's been lucky enough to not fall into the coverage gap has benefited from the Affordable Care Act. Under 26, you stay on your parents' plan. Up to 50% of Americans, under some definitions, say qualify as having a pre-existing condition. 50%, those people are protected under the ACA. The Affordable Care Act has also given Americans freedom. The ability to quit a dead-end job because you're not stuck there because you need the health insurance. If you are sick, or your loved ones are sick, you can quit your job, get a plan on the individual marketplace, start a new business, come up with a new idea, invent something amazing, take care of your family. Obamacare made that possible.
Yeah.
The House and the Senate have passed their first vote, which has just caught the ball rolling. Nothing big and scary and official has happened yet, but they have taken the first step to allow the big and scary and dangerous things to happen. Potentially, we are looking at 20 million or more Americans losing their health insurance. We are looking at 36,000 or more deaths per year if this Affordable Care Act is repealed. I am really highly involved in the disabled and chronically ill, mentally ill community. I'm a disability rights activist. I have a degree in disability justice. I spend a lot of time interviewing, researching, or just hanging out in support groups with fellow sick people. And my friends are terrified for their lives right now. There are threads in these support groups of young people that spend time regularly in the intensive care unit, that spend time in and out of emergency rooms, that rely on literal life-saving medical care, that if that vanishes, without a doubt, they will be dead. This is not hyperbole, this is not maybe if this might happen. People are going to die. This is a deadly, serious issue. So, a repeal is going to happen. That's where we are. The GOP controls the House, the Senate, the President, everything. So we need to work on harm reduction. We need to fight and be loud and make sure that the replacement plans that they put into place, that they propose, are not garbage. We need to make sure that we preserve as much of the progress as we have made as humanly possible. We need to fight tooth and nail to try to protect my friends that are looking at life and death situations if something is implemented like a high-risk pool, which is just just another word of saying a segregated healthcare plan where we can charge you a hell of a lot more and cut all of your benefits. That's not helping anybody. President-elect Trump in his press conference the other day said that he plans to replace Obamacare with something terrific, which would be fabulous. There are improvements that need to be made. The Affordable Care Act is not perfect. It's really not. I'm a big fan, but we could do better. But something terrific cannot reduce the cost for the federal government while placing more financial burden on the most vulnerable Americans. Something terrific. Cannot kick millions of people off of their health insurance because the prices skyrocket or they're no longer eligible because they happen to be born sick. Something terrific can't slash funding for Medicaid through block grants or per capita caps, which are just fancy ways of saying we are cutting the budget, we are cutting benefits, we are kicking people off of the rolls. That's not terrific. We can do better. We could implement replacements, but our congressional delegation, they need to hear from us because we need to see a new plan first. There are about 7 Republican proposals. These range from a full bill in legislative language from HHS Secretary Tom Price, that's a full bill, to a 200-word, very detailed plan from President-elect Trump, and all the way in between. I have read these, I've analyzed them, I'm actually writing a series of articles kind of explaining them. There's a lot of gaps in these. The language that is in these policy proposals is very, very different from what they are telling us is in these policy proposals. You need to read between the lines, you need to hold them accountable, and we need to make sure that the Utahns that represent us are actually representing us. Yes.